Take it away.
All right, thanks for having me back again. I was hoping we wouldn't have to do this, but here we are, still in the midst of a pandemic, for those of you that might not know that. We are, as Tim said, we're in the middle of vaccine rollouts. I'm going to share some data with you guys. We'll talk a little about where we're at with the vaccine, and then ideally what I'll do is just take questions, because ultimately what it comes down to, especially my job as the public information officer for the county's health department, is that we like to answer as many questions as we can. I'll even show you how to get to our vaccine interest form on the website for any of you that are wanting to fill that out. So I'm going to share my screen. Okay, so this is our current county metrics. If you can read that, as of our 2-week look back for January 17th to January 30th, we had a case count of 157 cases, which puts us at a case rate per 100,000 of 248.1 cases per 100,000, with a county test positivity of 9.8%. So all of those put us in these little extreme for business and recreation. We're still in extreme. We're in high for education because they moved the metrics for education up and adjusted those. And our county test positivity is in moderate. We have, let's see, where's mine? These are some of our case rates. If you look total numbers for Oregon and our total numbers for Coos County, have a surprisingly similar uptick over the last 6 months. Coos County's active cases, which is what we consider the last 2 weeks of active cases. You can see here we're at 177 for the last 2 weeks based on our 2-week adjustments. And we've had a little bumps. Most of our bumps are in relation to holidays where gatherings are something that we see a lot of, with the exception of our last hump that has to do with karaoke. The last 2 months have been the highest months that we've had so far during this pandemic. In December, we had 327 cases, and January, we decided to top that with 329 cases. And our cumulative hospitalizations have just been slowly increasing, as well as our deaths. Our highest were the last 2 months. We had 6 apiece, putting us at 16. So as of right now, our teams are working diligently with within the healthcare community. We've worked very closely with Barrie Hospital. We've worked very closely with Coquille Valley, Southern Coos, Northern Medical Center, to work together to try to get the vaccine distributed as efficiently as possible. We ran into some significant supply chain issues, though, and that really slowed down our ability to get the first run of vaccine out. We're really trying to make sure we get all of the second shots out, because we want to ensure that we have everybody that had their first one get their second one, and we have that full cycle done. And then we are working with educators, our first responders, healthcare community, and very soon it's going to be time for the 80 and older population. But it's all going to be dependent on how many vaccines we receive. So the number of vaccines we receive is really dependent on a number of things, population, as well as how many vaccines the state as a whole is going to be receiving. So we don't really know how many we're getting into Coos County really until they come to the door. We have an idea of what they say they're going to send us. It's whether or not we get all of those is a different picture. So I should probably show you how to, I'm going to show you how to get to, we have a new vaccine interest form. So if you go to cooshealthwellness.org, the very first thing you will see, if everybody can see this, is the vaccine update. And then it'll go away. So this tells you where we're at, and each one of these buttons, registration for organizations and registrations for individuals. So if you're an organization, you can click on that button and it'll take you to the vaccine interest form for an organization. And if you're an individual, you can click on that button and it will take you to the vaccine individual interest form for that. These are filled out and then sent to us, and it populates in a spreadsheet so that we can then filter those and then send texts and emails to individuals when it is time that they would be able to start scheduling appointments. If you know someone that doesn't have the ability to utilize this technology, just doesn't get it, we are working as quickly as we can at Coos Health and Wellness to do those on the phone with people. We're working on hiring someone to man our vaccine portion of our call tree over at Coos Health and Wellness that will help walk people through and even fill that out for them in the event that they don't have the ability to do so. If you have the ability to do so and you want to help someone fill that out, please, by all means, help them fill out that form if they just don't have the ability to do it themselves. If they don't have an email, it asks for an email. You can put none. If they have a phone that they can receive text messages on, put that in. If not, we can find a way around it. Hopefully we can share an email or share a phone number so that we make sure that that person gets that information. We do know that when you leverage technology like this, that there are some individuals that just don't have the ability to come along with that kind of technology. So we want to try to be as helpful as possible. Our front desk right now is taking probably about 125 calls an hour that are vaccine related. So we're trying to find a way to siphon that off from the front desk, because that has overwhelmed them as far as all the questions that are coming in. So we're really doing our best to try to get all that information out. So really what I want to do is just take questions from you guys. Like, what are some things that you have seen or some questions that you have, and then we can go. But you have to be able to ask them from somewhere other than a tropical beach, because I don't know at that point that you have any care in the world. No, I love the background is I'm sad that it's real. I would rather be there than here.
Okay, thank you, Doctor.
Question is,
yeah, Steve, if you got a question, we'll go to you first. But since we have especially a good turnout today, if you want to write a question in the chat section, I will try to monitor the chat section. If you raise your hand in the area, I will try to call out people who have questions. So we've got Steve, then we got Jim. Also, there is a hand raised section that I will try to look at in the participants area to see who has hands raised, but we'll try to do and get to as many questions as possible. But if you put them in the chat section, I will, if we don't get to them in the allotted time, I'll try to get questions over to Eric after the hour is up. Steve, go ahead if you had a question.
yeah, I would use the chat function, but the glare behind me makes it hard to see that part of the screen. So you'll have to forgive me for that. Eric, they were talking on the news just this morning about the next rollout of vaccines being distributed through the pharmacies, like we had been hearing some time ago. Do you anticipate that happening also in Coos County pharmacies, or is it going to be strictly continuing through Coos Health and Wellness?
It'll happen eventually. Yeah, that's something that we've talked about. We know that that's the goal, right? Is to be able to get pharmacies to start giving some of these and help take some of the pressure off of the healthcare community as a whole. We just don't know exactly when that's going to be, and I think that's still also going to be dependent on supply, right? If the supply chain has just enough to get to the health departments and the healthcare community hospitals, clinics like that, that's probably where they're going to stay until they have the ability to offset that. And once they do that, that's, I think, when we're going to get to some of the more general population. But the specialty populations, I think we're going to have to get that done before we're ever going to get to that part.
All right, question from Jim. Then I've got a few coming in on the chat. So go ahead, Jim, you had a question? You're still on mute. Okay, well, you figured if you work on the mute and I'll come back to you, or if you want to type it into chat. One of the questions. Oh, we'll come back to you, Deanne, in a second. We'll come back to you, Deanne. Heidi had a question. When you talk about positives, are those actual test positives or test positives and presumptive?
Test positives and presumptives.
All right. Go ahead, Deanne.
I went online and registered both my husband and I. It was very easy. The form is very easy. And he's eligible on the set. Oh, yeah. Okay. Anyway, we're registered. It's easy. It's very good. That's it.
User friendly. Good to know. Check out the online. The question on the chat. My wife and I filled out the interest form. The impression would be that we would receive some notification that our form was submitted, but we have no such acknowledgement. How do we know if it was received?
We were under the impression that the Google form populated an email as well. We were wrong. It tells you once you submit that your form has been submitted, and that is the confirmation that it went through. I would have to go and ask the people that are monitoring that if your form went through, but I would imagine I'd put all the money I own on the fact that it probably did. So I will ask, and then I will probably just respond to Tim, and with if there's a list, I could say these people were on the list.
Okay, that would be good. Another question for you. Seniors 70 and older are scheduled for the week of February 21st. Is that an accurate schedule?
Well, I mean, it's an accurate schedule. The schedule is going to stay the same. It's just going to make if the supply is there, we'll be able to start getting into there. Like I said, right now, we have to focus a lot on those individuals who got their first vaccine so that we can ensure that they get their second one and that we don't waste that first one. Then we are working still to work in group 1A with first responders, healthcare workers, and getting educators in with their first shot. So it is going to be dependent on the supply that we have, how far we can get into the next phase that's opening. So they're going to open. It's just whether or not we're going to have the ability to get those out.
Okay. Has Coos County recorded a positive for the mutated or any of the mutated versions of COVID-19?
No, not that we are aware of.
Okay. How you doing, Jim, on figuring out that? Hey, there you go. Oh, you had it.
Is it on now?
We can hear you.
I'm there. Okay. I went to my pharmacy yesterday and I talked to them. They said that they know nothing at this point, and they told them that they wouldn't have for sure before the 1st of April. And I registered at Coos Health and Wellness, and I'm definitely in the old age category. So I just wondered what my chances are, because I'm considering going back to California, and it doesn't look very good down there either. So I'm trying to figure out what my chances are.
It's hard to say. Like I said, we don't know how many we're going to get from week to week. OHA, when they send us something on later in the week, like, all right, you're going to get this many, it hasn't been, our normal number is 100. That's about what we get from a health department. I think we got 600 the last time, and those went and were distributed to other hospitals to try to help get the South County numbers up and finish our second phase. Almost all of those 600 were for the second round of the shot. So we're playing with two different factors. We're not getting a lot of first dose vaccine right now. We're getting mostly the booster, and then any of the first round vaccine that we get, which is usually a pretty small number, are still trying to make up that backlog of our healthcare community, first responders, and educators.
So it sounds like my chances aren't very good, like before the 1st of April then, really, even though we're going to 80 and over next week, it doesn't look like the chances are very good.
I think that that's probably a fair assessment, unless we hit a point where we've had a far higher number of people that decided they just didn't want to get it in those initial populations. And that we have seen some. We're probably not going to have to vaccinate the entire population, because I mean, some people don't trust it, don't want to get it. But I would say April, 1st April probably is pretty safe. But hopefully we get there much sooner. Hopefully the supply chain frees up and there's all of a sudden we have an influx of shots and we've just got to line out the door. That would be an ideal situation, not from a manpower state, but it would be an ideal situation for the county. So we're going to try to keep everybody up to date with all the newest information that we have.
We have any other questions coming in? Deanne?
Yes, my husband and I both signed up to be willing to give shots. So I don't know how that goes, but we did sign up that we would be willing to. They asked retired doctors and nurses to sign up, and we did, to administer. So I don't know who has that list or if they're going to get to use it or not, but there are people out there that are willing to be on that list.
Well, that's a good, as a follow-up along those lines, what is going to be, or what do you see as the biggest need for volunteers, or is there any need for volunteers on the distribution side of things?
I think once we have enough vaccine that we're doing large scale distributions, I think if you've got the capacity to volunteer, there's our mobile reserve corps, they have need for volunteers. I would contact Anthony Arton, which is our public health director, or Russell Johnston at Coos Health and Wellness, and say, hey, I want to help in any way possible. If there's an event coming up, please let me know. You can call our front desk at 541-266-6700 and ask for the public health director. And even if you leave a message and just say, hey, I'd like to help.
We registered with serve.org. Yeah. So I don't know if that covers this area or not.
Somebody did say I'm signed up. Eva said I'm signed up on serve.org and with Coos Health and Wellness and have gone through training and will be giving vaccinations next week at the hospital in the Medical Reserve Corps. So, question from Heidi: what is the percentage of healthcare workers that have been vaccinated in Coos County?
I don't have that number in front of me. I will see if I can find out from our public health director.
Okay.
Kim, this is Bob Huggins. How do you send I've written something in chat. I don't know how to send it to you.
Oh, well, if you want to go ahead and ask your question, Bob.
Yeah, I was watching TV yesterday. There was a national health official that indicated that those that have the vaccine supply should be giving the first vaccine to as many people as possible and not hoarding supplies for a second shot for those that have had the first. It doesn't sound like that's what Coos County's doing.
Oregon Health Authority sends them out in batches. You get booster vials and you get first dose ones. So we get what we get from OHA, Oregon Health Authority, and then how they tell us to administer the vaccine. So we're going based on the guidance that we're given at this point. If that changes, and now that being said, if we go to an event or we have an event and we've got 7 or 8 doses, right? We would do a very similar thing that if you saw the Jackson Josephine County vaccination event where they walked down the snowy road because they were, there's a jackknife truck. They went 46 vehicles to give 6 vaccinations. They had to get them in arms because it'll go bad, right? It's only good for 6 hours after it's thawed out. So in the event that we have something going on and we've got to get shots in the arms, whether it's a booster or not, we're going to try to get the medication in someone before it goes bad. But we've got to try to cover based on what we've been given guidance to do.
Are the first shots and the booster shots there, are they totally different or different amounts?
No, basically, if you go to the Moderna site, which is what we get, it looks like they're the same. They're just allotted differently because they send based on what they know they sent before, so that they can make sure that they cover the areas that they've distributed vaccines to. So they have them under a different allotments so that they can ensure that they know how many that they sent, how many were covered, and that they don't have to try to keep track of, well, this person didn't get one because we used it for this person over here. It's the same reason they tell you if you've had your first vaccination, go back to the site that you got the first one at, because that's how it's distributed throughout the state.
So it's more of a, sounds like it's more of an accounting reason that they do that?
Yeah, that's the way it feels.
So if we sign up on the Coos County Health and Wellness site, is that where we're going to get our shot?
Not necessarily.
Okay.
No, because we're working as a community to try to get it done. If they say, hey, Coquille Valley has an event coming up, you would fall into that, go over there and get your vaccine. You would go back to wherever that was to get your second one, but that doesn't mean that it's going to be Coos Health and Wellness that gives you your vaccine.
Thank you.
So Eric, another question's come in. When it comes time to get inoculated, what do you consider a reasonable wait time? You see long wait lines with people waiting hours to get vaccinated.
Well, I know that we've really, and I want to say most of the groups that have been working with us are trying to do it based more on appointment time, right? So that we don't have long lines and unknowns, that they're using things like Eventbrite, which is more of an e-ticket tool. That's what we'll be using to help with traffic control as well when we do a much larger event, is that we will have scheduled tickets for specific time frames, because there is a time you got to wait about 15 minutes to a half an hour after your shot, depending on your underlying conditions, to ensure that there isn't any negative reaction that we need to get you medical attention for. So we try to do it based on an appointment type schedule so that we don't have those issues.
Jim, you got a question? Oh, and then I'll come to you, Rick.
How important is the timing on that second dose? They're saying 3 weeks. Is that flexible on out to a month or two, or what?
That data is still coming in, but there is some data to suggest that you could get it a few days before and up to, I want to say it was maybe a couple weeks after that 28th day. There is some flexibility. They're just trying to figure out how long you can go right now before the efficacy drops off significantly. But we're still early in this process, so there's a lot of data collection that's still trying to be done and figuring out what that means for those kinds of questions.
Rick, go ahead and take yourself off mute. You have a question?
Yeah, you've alluded to this to some degree, but could you describe a little bit more of the process when you come up? You've registered, you've come up. Are you going, what order are you taking the people in within the group? First in, first out? And then will you tell us where to register or where to go to get the shots? Do you have a procedure already outlined?
So you'd go and fill out that form, right? That's first step one. And then that populates into a database and spreadsheet. So then when we know, like say, let's do with 80 and above, we would filter that based on the age ranges that you would select in the form. And then if you have underlying conditions, and it'll formulate all that out. So then we'll send information to you that would say there's an event at this place, and ensure that we can help get you signed up for it. And then you would be able to go to whatever that location would be, whatever that vaccination clinic for that time would be, and then go get yours. And then you would get a, hold on, let me get mine. You'll get a card that looks not like my blue background. Hold on. You're gonna have to look at my purple wall. All right, so you get a card like this that would have date of birth, lot number of the vaccine, when you got it, where you got it, and then on the back it says when you need to get your next one. So you'll get one of these that you want to hold on, because that's what you're going to need so that you can go back and get your second one. Ideally, this works perfectly.
Ideally.
Sure, that's exactly what it'll happen. It'll work perfectly.
You mentioned reactions. What kind of reactions have you been seeing so far?
Mostly it's fatigue. Most of them come, the biggest reaction we've seen are out of the second vaccine. A lot of people get just really cruddy for a few days. My mother-in-law got hers and just laid on the couch, I think, for 3 days. She was just wiped out. We have seen some anaphylactic responses around, not necessarily Coos Health and Wellness. We haven't seen any, but I know there's been a lot of reports. If you have a history of severe allergic reactions, that there can be some problems. That's why we have you wait and check that and make sure that you're going to be okay before you go wandering off.
Yeah, my wife had her second dose working at the cancer center, and the second one was, first one hardly was a thing. The second one, she the arm got a little warm and a little more of a fever, not a fever, but a little more just like a fluish-like feeling for about a day or two, a little rundown.
I compare all of my vaccines to the 5 anthrax shots that I got, and I'm feeling okay so far.
Jim, I'll come. I got a couple questions. I'll come back to you, Jim. But I see you there. I'll come back. We are receiving the Moderna vaccine, but we are in line to receive the J&J single dose.
The Johnson & Johnson one?
Yeah.
I think that's, I mean, I haven't heard what that means for us. I know that we know that there's the single dose. It does indicate at this point that maybe the single dose isn't as effective as the 2 Moderna, and that Johnson & Johnson may be tossing around the idea of a booster. So it might not stay single dose for very long, based on the efficacy is much lower supposedly than the Moderna or the Pfizer, but it's still pretty good. I mean, it's better than not getting one.
And somebody else just following up on the reactions, 0.5 milliliters for Moderna, 0.3 for Pfizer injected into the deltoid muscle. Scheduling at the hospital has been very efficient. For each dose, I had a fever, chills, and fatigue for 1 day and a sore arm. So, Jim, go ahead. You had a question.
Well, yes, I have a history of having had anaphylaxis. I was having a MRI done, and you take the contrast medium, a CAT scan, you take the contrast medium. I have anaphylaxis to that contrast medium. Would that mean that I'm probably best off to receive my vaccination maybe in a medical facility, full medical facility, or rather than just going into a pharmacy or clinic?
If you have the opportunity, yeah. Even if we had one of our larger events that we were going to do the vaccination events for, like we've talked about a much larger scale one, we're also going to have base cities on hand for those situations. So if you get it through one of our pods, our point of distribution, or if you get it through the a medical clinic or hospital of some kind, probably makes the most sense for you, I would imagine.
Let's see. Getting towards the end here. A few more questions before we move on to wrapping things up here. Let me check the other page, because I got a whole other page that I haven't been able to check in on. I don't see anybody over there either. One question I wanted to, we've been hearing some things just as we get to the front end of the, we're still on the front end of vaccines hitting, but we're moving into this. There's been a lot of cautioning about getting too far ahead of ourselves in terms of people still need to take precautions. So what's the overall feeling from the health and wellness on how people need to proceed as we get these shots?
There's few changes that we would recommend, even if you've had both. Right now, the quarantine piece of it, in the event that you were like a close contact, if you had both of your vaccines, we wouldn't place you in quarantine at this point. That's the new guidance for that. But all of the World Health Organization, CDC, everybody recommends wear your mask still. You're not necessarily out of the water, nor do we really understand what it means for those individuals that are fully vaccinated and their ability to spread COVID still. So wear your mask, socially distance, don't start having group activities, because you guys have had your vaccine, you still need to take the precautions. This is still really early, like you said, Tim, and these are very new vaccines. So we need to take the precautions still. It is important that we maintain the hygiene. You wash your hands, socially distance, wear your mask. Don't do those things that you would have done prior to, or you wouldn't have done prior to your vaccine.
Is there, I don't know, I put you on the spot, but is there is there a light at the end of the tunnel? Do you look down and say, where are we looking at in terms of a timeline of when, you can start to think about shedding the mask and start to go, if this does this, we can start to think about this?
I think our optimistic view is if we could get at least 60% of the population vaccinated, that maybe we're moving in the right direction. I think that we're also very guarded in the fact that we want to ensure that everything is right before we say, let's take off our masks. I mean, you can do some really cool stuff with masks, right? You can get some really neat ones. I got one that looks like the front of my ship, and there's all sorts. You can make it a fashion statement. We could make one out of Steve's shirt from the Hawaiian shirt that he's got there. Like that would be a pretty nice mask.
We do have an Oregon Dungeness crab mask. If anybody
I know,
wants one.
I have one. I have one.
Good. See?
Yeah. No, we're always going to take the more guarded approach on this because we want to make sure that everybody is safe. But I think we want to try to get to that 60% vaccination would be nice.
What about the double masking?
Double masking has come up a lot. It does show to be a little bit more like if you've got a cloth mask and you can wear like a procedural mask under it, it does improve the efficacy of wearing the masks. And honestly, we have this new variant out there. We really don't know. I mean, it's highly contagious compared to what we've got right now. So we still want to make sure we take those precautions. If you feel like you want to wear 2 masks, it's not going to hurt you. It does show to have some improvement on having the overall effectiveness of having the masks on, but it would be more like the cloth one and a procedural one or a KN95, not like 2 cloth masks.
And what about the filters, the ones with the filters?
You know what? I'd have to look. I have a couple of those. So now I wonder if that, I would still say that that's probably, you probably still could go with the 2 masks, even if you have one with the filters in it. I don't think those filters are all that great, like 2.5 or something like that.
All right. Eric, thank you so much. We really appreciate your time. Let's give him a Rotary round of applause for coming and sharing a lot of information with us today. And if you want to let anybody know, I know our Rotary editor-in-chief who wasn't able to be here today is going to take some time to put something together, and then we're going to get it on our Coos Bay North Bend Rotary Club Facebook page. So if you know of anybody that couldn't be here today but wants to get some information, we're going to be sharing it on our social media. So thank you, Eric, and we appreciate it. I'm going to go ahead and stop the recording.